Parkinson's disease, focused ultrasound ablation of the globus pallidus. Parkinson's disease is a progressive neurological condition that manifests in problems with motor control, tremors, basic movement, impaired balance, and stiffness. These symptoms occur as the brain produces less dopamine, the neurotransmitter that is responsible for producing smooth, purposeful movement, thereby disrupting the normal functioning of the basal ganglia. Parkinson treatments involve medicine, surgeries, and currently, within the last 10 years, focused ultrasound treatments. Medicines involve levodopa, which increases the dopamine levels directly and is the primary medication being used. Dopamine antagonist mimics the effect of dopamine in the brain, and MAO inhibitors increases the dopamine production in the brain and are used early. Now, Parkinson treatments for surgeries have included surgeries where probes or heated wires are inserted into the head through a borehole using MRI imaging. Pallotomy creates a lesion in the globus pallidus to help with bradykinesia, tremors, and rigidity. Thalatommy creates a lesion in the thalamus, ventricle intermediate thalamic nucleus, VIM, to decrease tremors. Either one of these are currently a choice in the United States. You can see the borehole in the head is a lot more invasive than some other methods. One of the newest surgeries that came out in 2002 was a deep brain stimulation. Is a surgical procedure that involves implanting electrodes into specific areas of the brain to deliver electrical stimulation, reduce tremors, increase mobility, and reduce stiffness. It does require a training period. When the probe is initially placed in the brain, there is a 2 months before you can begin, quote, training the brain to do the correct stimulation. Focused ultrasound ablation. The first one to begin was the magnetic resonance guided focused ultrasound, MRG FUS, ventricle intermediate thalamic nucleus, in 2016. This procedure focused mainly on tremors. For the globus pallidus focused ultrasound ablation was just recently passed by the FDA in 2025. The focused ultrasound ablation in the globus pallidus creates lesions in the globus pallidus intersts, which is a part of the basal ganglia that controls movement. Why this one is important in all of the ultrasound-focused ablation is that it is incisionless. It does create an ablation on that part of the brain. There are thousands of ultrasound waves focused on one spot of the GPI. Prior to the treatment, a pre-surgical treatment is a CT scan is done to determine the skull that the skull is greater than or equal to 0.45 thickness. The head is shaved. Then the inner working of the helmet is placed on the individual. Marks are made so that the person does not move during the surgery. The person is placed in the helmet in the MRI. Then the ultrasound begins to focus on specific areas. Initially, they are not ablations, but just tiny spots, and it's not all of the ultrasound to make sure that they are using the correct area of the globus pallidus. When the treatment is satisfied, then 1,000 of the ultrasound waves begin to focus on part of the globus pallidus that they wish to ablate. The procedure has real-time guidance with magnetic resonant imaging to monitor the tissue temperature, while the ultrasound beams are delivered to heat the target gradually. Initially, low-energy sonifications are used to reversibly heat the target and perform clinical testing to detect preliminary effects or side effects and determine whether the location of the target should be modified. Then, a permanent ablation, burning a lesion, is performed with the goal of immediate and sustained clinical improvement. The results have been improved dyskinesia and improved motor function. The adverse effects have included headache, dizziness, nausea, dysarthria, and gait disturbance. Limitations. With the globus pallidus focus ultrasound ablation, there is no opportunity to treat progressive worsening of the motor symptoms. Thank you very much.